If you don't sign up for Medicare timely, you may end up with some penalties. So here are some tips to you so that you can avoid penalties that will stay with you for the rest of your life. The time to figure out whether or not you have to take Medicare at 65 during your 65th birth month is at least 6 months before. You want to have an understanding of this so you don't find yourself in the middle of when you should be enrolling, not having an idea of what you need to or don't need to do. So most people are going to start Medicare at 65. And for those of you who are still working or your spouses, it's possible that you will delay starting Medicare. So let's get those of you who are still working, that discussion out of the way, okay? If you are still working and you're at a company with 20 or more employees and you have group health coverage, you can delay Medicare. You will not be penalized later when you sign up because you're going to have what's called a special enrollment period. So what I would suggest you do is if you fall into that category, confirm with your work that your plan is primary to Medicare. You may want to do a comparison between your plan and Medicare, and then you can decide what you want to do. For those of you still working or a spouse still working at a company with 19 or less employees, you won't be penalized for not taking Medicare if you have group health coverage. However, in that scenario, you should be signing up for Medicare because if you are at a company with 19 or less employees, your plan is not primary to Medicare and you're going to need Medicare to have complete coverage. So always go check with your HR. Ask them, is this plan primary to Medicare or not? Typically in that scenario, 19 or less, it is not, and you're going to want to sign up for Medicare even though you won't have penalties for delaying. Now, for the rest of you, for those of you who are not working or your spouse is not working or they are working but you don't have group health care coverage, you're going to want to sign up for Medicare during what's called your initial enrollment period. It is a 7-month window surrounding your 65th birth month. So if you're born in July, you're going to count back 3 months. You can sign up during that time. You can sign up during your birth month and the 3 months thereafter. An application during any of those 7 months is going to get you a timely enrollment, but the month that you enroll determines when your start date is going to be, and I'll do another video getting more detail into that. If you mess up and you do not enroll during that 7-month window, then you possibly will end up with a penalty. Your next chance to enroll is going to be during what's called the General Enrollment Period, the GEP. It's January 1st to the end of March. And if you enroll during that time, you'll get to start Medicare. But the question is, how long? How big of a gap of time was it between your 65th birthday and when you actually end up enrolling, which is going to determine whether or not you have a penalty. And remember, again, penalty that stays with you forever. So if there's more than a 12-month window where you didn't take B, you'll have a 10% penalty. And for every 12-month window, it's going to stack on top of each other. There's also penalties for Part D. So start doing your homework, reach out to somebody like me or find someone that you trust. Figure out if you need to start, and if you do, do it timely. That way you will not have penalties.